In my last video, I was talking about adjusting your workspace, so sitting, standing position, things that you can do. And I did get a little bit of an offshoot of somebody who was having a lot of pain, wasn't able to sit, but then when they stood and picked up their foot to put it on something, got real sharp shooting pain. And I wanted to touch base on this because this is a movement pattern I actually see quite a bit with hypermobility, and I want to make sure that you're doing it correctly. One is that when you go to pick up your foot and you're going to put it on a step, a stair, whatever you're doing, is you cannot use your back. Your back is not a hip. It's not going to work well for you that way. When you go to pick up that foot, you've got to keep this stable. You've got to use that hip flexor to pick up that foot. If you start trying to use your back, I'll show you this way because you can see it better. If you do this, okay, and I know there's a bunch of you out there who are doing that, that kills your back, and your back will lock up so fast. The other thing is that if you're trying to go this way, so if I'm trying to go back, that's also using my back. I've got to keep myself stable here and pick up my foot, so I'm not going side to side, I'm staying here. There are cases where that SI is locked up, doesn't move. You go to pick it up and that kills you back right where that joint meets that kind of tailbone area. If that happens to you, there's an easy thing that you can try. And what you're gonna do is you're gonna lay down and you're gonna kick your leg like you're kicking mud off your shoe. It is literally that simple. The side that is super painful when you go to move your leg, you're gonna lie back. So if it's my right side here, then what I'm gonna do is I'm gonna do that movement. I'm just gonna kick my leg, just like I'm kicking mud off my shoe. And that's a correction to help loosen up that joint. Now, what if you try and do that and it hurts? Don't do it again. If you try and do that and you're getting pain, then I would say go to your PT, your chiropractor, your massage therapist, have them help you, because obviously something is stuck. Sometimes you can get rotation in your back. Rotation is so hard to treat by yourself. That would be a time where I'd say, yeah, I get somebody else to kind of help you navigate that and get that fixed up. Take a look at that. Hopefully for any of you who are doing the funky shift, watch that, see if you can get that straightened back out, and that will help you. Stairs, standing, all of that will work much better.